All right, so if you're an athlete, you've probably been there. You've got that nagging injury that just won't go away. So you start Googling, trying to figure out what to do. And you immediately hit this wall of confusion. You see dry needling and acupuncture popping up for the same exact problem. So what's the deal? Let's clear this up right now.
I mean, think about it. Let's say your IT band is just screaming at you. Your physical therapist, who's a total genius with your movement mechanics, mentions something called dry needling. But then, your training partner, who just crushed their half marathon, is telling you they owe it all to their acupuncturist. You look at pictures online and it looks exactly the same. It's the same thin needle going into the same spot. So seriously, what is the real difference here?
Okay, let's get right to the heart of it. This is the most important thing to understand. Dry needling is not some brand new, separate medical discovery. It is acupuncture. To be specific, it's just the modern Western name for a technique acupuncturists have been using for over 2,000 years. So this whole conversation really isn't about which one is better. It's about who is the person performing it and what's the depth of their training.
To really get this, you got to look at the history, because it's actually pretty fascinating. This isn't some story about East versus West or mysticism versus science. Nope. It's a story about two different medical traditions, separated by thousands of years, that discovered the exact same truth about the human body.
So check this out. Way back in the 1st century BCE, you had these ancient Chinese doctors who would feel around on a muscle and find these super tender spots. When they pressed on the right one, the patient would literally shout Ashi, which means, ah yes, that's the spot. Now flash forward 2,000 years to the 1940s. A doctor named Janet Travell, who later became President Kennedy's personal physician, starts mapping out these same exact spots. She had no idea about Ashi points, and she gave them a Western scientific name, myofascial trigger points. And that's really the whole thing right there. We're talking about the exact same points in your muscles. They cause the same kind of pain. They respond to the exact same treatment, putting a needle in them. The only thing that's different is the language used to explain why it works. One system talks about qi and blood stagnation. The other talks about hypersensitive nodules. It's just two different languages describing the same reality.
Okay, so if we're talking about the same basic technique, where's the real difference for you, the athlete? Well, it all comes down to the practitioner's scope of practice. It's really the difference between someone who has learned how to use one specific tool versus someone who's been trained to use an entire toolkit.
So think of it like this. Dry needling, when it's done by a PT in a state that allows it, is that one tool, releasing a trigger point, that muscle knot. And it can be super effective for that. But acupuncture includes that exact same tool, but it's just one part of a way bigger system. A licensed acupuncturist is also looking at things called motor points. They're balancing entire kinetic chains, how all your muscles work together as a team, and they're looking at the big picture stuff, like your sleep, your stress, and your overall ability to recover.
So what are these motor points? This is a really key difference. You see, if a trigger point is like a knot in the muscle fiber itself, the motor point is like the electrical outlet where your nervous system actually plugs into the muscle to make it fire. By needling these specific spots, an acupuncturist can actually retrain your brain to muscle connection. We're talking about waking up muscles that have kind of gone to sleep, or calming down muscles that are just chronically firing and tight. It's a much deeper level than just releasing a knot.
Now this slide really puts the training aspect into perspective. And let me be clear, physical therapists are absolute experts in movement and rehab. That is their core doctorate level training. Dry needling is an extra skill they can learn in a weekend or post-grad course, usually somewhere between 24 and 80 hours. For a licensed acupuncturist though, needling is their entire profession. It's their core competency. It's what they spend 3 to 4 years and over 3,000 hours mastering in a graduate medical program.
And hey, this isn't just my opinion. This huge difference in training actually led the American Medical Association to issue a statement. Back in 2016, they said that for the sake of patient safety, anyone performing this kind of needling should really meet the training standards required for licensed acupuncturists. That just highlights how much skill and deep anatomical knowledge is needed to do this both safely and effectively.
Okay, let's zoom in a bit, especially for all you athletes here in California. The way the law is set up in this state has actually created this really cool and very effective model for healthcare. It's not about fighting over turf. It's about collaboration, which leads to way better results for you.
So let's be super clear on this one. In the state of California, the law is simple and direct. Anytime a needle is inserted into the body for a therapeutic reason, that is legally defined as the practice of acupuncture. That means it is not in a physical therapist's scope of practice. Here in California, only licensed acupuncturists and medical doctors are legally allowed to perform this therapy. And it's all about public safety, making sure the person holding that needle has thousands of hours of training.
So, what does this actually look like in real life? This story is a perfect example. We had a marathon runner with this awful IT band pain. She was already working with a fantastic PT on her hip strength and her running form. The PT knew that needling would be a game changer, but since they're in California, they couldn't do it. So they teamed up. The PT kept dialing in her movement while the acupuncturist did comprehensive needling, releasing trigger points, retraining motor points, and also picked up on the fact that she was just totally exhausted, so they added treatment for that systemic fatigue. The result? 2 months later, her pain was gone, she was sleeping better, and she crushed her marathon goal with an 8-minute PR.
And that's the whole point. As the acupuncturist in that case, Mike Cohen, puts it, we're teammates in their care. Neither one of them could have gotten that amazing result on their own. The PT fixed the mechanics, the acupuncturist fixed the tissue and helped her body heal from the inside out. That is what ideal patient-first healthcare really looks like, experts working together.
All right, so let's wrap this all up by putting the power back where it belongs, in your hands. Now that you get the history, the scope, the training differences, how do you actually make the best choice for your own health? Well, it just comes down to asking a few smart questions.
So whether you're talking to a PT in a state where they can do dry needling, or you're talking to a licensed acupuncturist, here are 3 simple questions you should always ask. Number 1, how many hours of needling-specific training do you have? Number 2, is your goal just to release this one tight spot, or are you looking at the whole system to see why it got tight in the first place? And number 3, what are the legal rules for this in my state? Being an informed patient is your best.
So ultimately, the one crucial question I want to leave you with is this. When you go to get treatment for an injury, ask yourself, is this plan just chasing the symptom, the tight IT band, the sore Achilles, or is it designed to figure out and address the root cause of why that muscle got overworked to begin with? Are we just poking the knot, or are we looking at the faulty movement pattern, the systemic fatigue, and the biomechanics all at once? The answer to that question will guide you to the kind of treatment that brings real, lasting recovery.